We still don't have information about, prior authorization denials by type of service, for example. We only have, information on aggregate denials or information at the plan level. Currently, we only have information at the contract level. And what that means is that we're just, not able to assess things like whether, certain services are denied more frequently than others, or whether certain plans tend to deny services more often than others. And that is information, that could be useful to people, particularly if they have like a service that they tend to need prior authorization for, say like every 3 months, to know, whether a plan has, tends to require prior authorization, might be informative when they're selecting their plan. Another area that we've talked about in terms of data gaps is the use of supplemental benefits. CMS has recently made some changes to require plans to include data about use of supplemental benefits that should be available, I believe, starting in 2025. But currently, we don't have data about how often they're used, how much people are spending out of pocket, whether there's differences by use in certain areas. And we're also just not able to assess whether the use of these benefits truly has a positive effect on health outcomes or affordability, despite a fair amount of money being allocated to these benefits.